Early detection and treatment are pivotal to halting the spread of the coronavirus. This echoes the stance of the Nigeria Center for Disease Control and the World Health Organization, with both advocating for more testing centers across the country. It was their underlining message when the Director General of the NCDC met with the Commissioner for Health in Asaba, Delta State. Ikenna Mechi has more on this.
The Director General of the Nigerian Center for Disease Control is here in Delta State together with the World Health Organization team to see how the state is responding to the COVID-19 pandemic and to see what to impute and what to take home and to ensure that the state work in tandem with the Nigerian Center for Disease Control and the Presidential Task Force on COVID-19. The Director General of the Nigerian Center for Disease Control arrived at Asaba with the field officer of the World Health Organization in what they called a working visit to Delta State.
They are here to see what we are doing and be sure that we're also doing it right.
Our role really is to support the states. The states are the front line of the response.
The visitors were received by the Commissioner for Health at the Nigerian Institute for Medical Research, Asaba. The team moved to the isolation center at the Federal Medical Center, where 2 coronavirus patients are receiving treatment. The need to establish a testing center was emphasized when both parties arrived at the second isolation center at the Asaba Specialist Hospital.
I must say we've been really impressed by the efforts of the governor, the government, the EOC, and the colleagues in Delta State, and the level of preparedness, both in terms of how you've handled the few cases you've had, but in your preparedness for cases to increase. My role is to serve the whole country, and we prepare for the worst, but hope for the best. So our working assumption is that the whole country will have some confirmed case eventually.
So as we move forward in response to the outbreak, the vision is that we will have more states coming on board to be able to test, and that this is a critical part of the whole response strategy, that you detect cases early, you test, you isolate them early. That is how we'll be able to control this.
With 4 isolation centers, Delta State has 4 cases of the deadly virus. It has recorded 1 death, with 3 patients responding to treatment in other isolation centers. Ikenna Mechi,